Several weeks ago, CGTN's crew in Wuhan were all tested for COVID-19 and came back negative. Good news for us. But the bad news, so far about 1,500 in China turned out positive, yet they're not likely to show any symptoms. The Chinese government says these people are infectious. Effective April 1st, the National Health Commission is including a tally of these cases in its daily outbreak report. So we set out to learn more from the agency about the so-called asymptomatic cases.
In its third version for prevention guidelines released on January 28th, the NHC defines those who have tested positive but show no clinical symptoms as asymptomatic cases. The Commission requests their report within 2 hours, followed by inquiry and treatment within 24 hours. Steps will be consistent with measures taken for confirmed cases, which include travel history, all contacts, and 14-day observation if required. If the case gets symptomatic after incubation, it is then a confirmed case. If not, it is an asymptomatic case. Having taken it as the origin of infection since the beginning, the NHC, in fact, has put these cases under control. Given the positive trends of the epidemic control and decreasing numbers of confirmed cases, the asymptomatic cases get relatively more attention, so the Commission has decided to publicize it for better prevention.
But should the public worry about possible virus carriers walking around?
All infectious diseases have symptomatic and asymptomatic victims, with proportions varied. What is certain is that they are all infectious, so the public should stay vigilant. Given that overall confirmed cases are gradually diminishing, so are the asymptomatic cases. Efforts will continue to screen out these cases through inquiry into COVID-19 patients. The public should be aware that the risk remains and preventive measures can reduce the virus to a certain degree. During social activities, every individual is at risk, and masks, hand washing, and social distancing are necessary and helpful in preventing not only COVID-19, but also other contagions.
Screening and testing are sure to continue, as physicians say once communities trace the origin of the asymptomatic cases closely, the risk of further infections could be better managed. 周嘉欣 CGTN 武汉